Hi everyone, so let's start the NEET PG marathon for the surgery. This is your faculty for surgery, Dr. Pritesh Singh. If I'm audible and the screen is visible, please send a thumbs up in the message or chat box. Good evening Rahul, good evening Ajit, good evening Kumkum, good evening Neelam. Okay, so I'm audible and visible. So let's start with first question. First, you have to tell me the answer and then we will discuss. A 50 years old female was brought to the hospital with enlargement of the breast. The image is given below. What is the preferred treatment option? So you know what is the diagnosis here. This is Phyllodes tumor, also known as cystosarcoma phyllodes. So tell me what is the preferred treatment. I'm waiting for your reply. Rahul, Diksha, AK-47. Okay, AK-47 is there. Pankhudi, Shoaib Khan. Everybody is marking A. Atanu Shahu, everybody is marking A. Majority of you are marking A. So what is the diagnosis here? Affected breast is massively enlarged. Here you can see the affected breast, it is massively enlarged and it's a characteristic feature of what? Phyllodes tumor. This is characteristic feature of Phyllodes tumor. And you know what is the other name of Phyllodes tumor? It is also known as cystosarcoma phyllodes. One important point is there. What is the basic difference between carcinoma and sarcoma? In carcinoma, the most common route of spread is lymphatic. And in sarcoma, the most common route of spread is hematogenous. Right? So what is the other name of Phyllodes tumor? This is cystosarcoma phyllodes. Other name is cystosarcoma phyllodes. Okay? And all of you know that it behaves like sarcoma. And if it behaves like sarcoma, so what is the most common route of spread? Obviously, the most common route of spread will be what? Hematogenous. An important point that here lymphatic spread is not seen. So in cystosarcoma phyllodes, lymphatic spread is not seen. Clear? What is the difference between simple mastectomy and modified radical mastectomy? In modified radical mastectomy, apart from simple mastectomy in MRM, apart from simple mastectomy, we remove lymph nodes. Which one? Level 1 and level 2. So since you remove level 1 and level 2 lymph nodes also, but in cystosarcoma phyllodes, no need to remove lymph node. Why? Because there is no involvement of lymph node. And that's why here, which treatment option is preferred? Obviously, it is simple mastectomy. We are not going for radical mastectomy. We are not going for modified radical mastectomy, because in radical mastectomy, you know, apart from simple mastectomy, 1, 2, 3, level 1, 2, 3 lymph nodes are removed and we have to excise pectoralis major and minor. Clear? So the correct answer for this question is A, because the diagnosis is cystosarcoma phyllodes. So everybody is correct. All of you are correct. Now, question number 2. See the question number 2. Here, a known case of papillary carcinoma of left breast had come to your hospital for surgery. A modified radical mastectomy procedure was done, and on second post-operative day, During your rounds, the patient presents with the following findings as shown in the figure below. Which nerve would have been damaged during operative procedure? Tell me, this is winging of scapula. So here you can see during pushing or punching, this part is more prominent. Winging of scapula. And all of you know that winging of scapula is because of injury of which nerve? Tell me. Yes, everybody is marking correct answer. And the correct answer is what? Long thoracic nerve of bell. And you know that this long thoracic nerve, it is going to supply which muscle? Tell me the name of muscle. Dr. Manish is correct, first person to answer. Serratus anterior, no. Swati is also correct, very good. So obviously it is going to supply serratus anterior. It is going to supply the serratus anterior. So correct answer here, that is what? Long thoracic nerve of bell. Now you tell me, what is the nerve supply of latissimus dorsi? I am waiting for your reply. Yes, Ishika Jhajaria, Kumkum Upadhyay, Anshu Shukla, Rahul, AK47. Everybody is marking correct answer. Tell me, which muscle is supplied by thoracodorsal nerve? Thoracodorsal nerve is going to supply which muscle? It is again related to breast. Tell me, I am waiting for your reply. Yes. Which muscle? Pankhudi, no. Pankhudi, it's not spinal accessory nerve. Yes. Thoracodorsal is supplying which muscle? Yes, latissimus dorsi. Very good, Dr. Dreamer. Yes, very good, Dr. Dreamer. It is latissimus dorsi. Latissimus dorsi. And you know that these are the two nerves commonly injured. There was one question and I am waiting for your reply. During sentinel lymph node biopsy, one nerve is typically injured. During sentinel lymph node biopsy, one nerve is typically injured. What is the most commonly injured nerve? I am waiting for your reply. Most commonly injured nerve. Most commonly injured nerve. Tell me, most commonly injured nerve during sentinel lymph node biopsy. Most commonly injured nerve. Very good, Dr. Manish, Megha, Diksha, Santosh Saroj, Dr. Dreamer. Everybody is marking the correct answer. It is intercostobrachial nerve. All these questions are asked frequently. Clear? So it is intercostobrachial nerve which is most commonly injured during sentinel lymph node biopsy. Okay. Now see the question number 3. Again a repeat question. Similar questions have been asked in pathology, and these kind of questions were asked in INI-CET, it was asked in AIMS, it was asked in FMGE as well as NEET PG. And let me tell you, almost every year this question is asked. A patient presented with presence of thyroid swelling and weight loss, means malignancy. Physician found presence of cervical lymphadenopathy, decided to go for thyroid biopsy. Histopathology report of patient suggested presence of orphan NEI nuclei. Here you can see these are optically clear nuclei, and this is also known as orphan NEI nuclei. Which of the following is most likely diagnosis? All of you are correct. Everybody, Dharmendra, Rajat Gupta, Tojo Beni, Aditya Roy, Pankhudi, Shubham, Mahesh, antidepressant, Pankhudi, everybody is marking correct answer. Obviously, there is presence of orphan NEI nuclei, that is optically clear nuclei, and it is seen in papillary carcinoma thyroid. There is another question related to this papillary carcinoma thyroid. It is in relation to pathology. What? There is dystrophic calcification. This question is asked. There is dystrophic calcification. Tell me, what is the name of these bodies? Dystrophic calcification. Very good, Divya. Divya, very good. Samoma bodies. Yes. So there is presence of samoma bodies. Now you guys tell me in which case or what are the malignancies where these samoma bodies are seen. Samoma bodies are seen in which conditions, and how to remember? The mnemonic is PSM. How to remember? Mnemonic is PSM. So P means papillary carcinoma thyroid and papillary variant of RCC. It's the papillary variant of RCC. S, that is serous cystadenoma ovary. Serous cystadenoma ovary. And you people tell me M means, I am waiting for your reply. M means which tumor? And this question was asked last week in FMGE exam. Yes, which tumor? Very good, Shweta. Shweta, Rajat Gupta, Manish, Deadpool, PSI, everybody is marking correctly what? It is meningioma. This is meningioma. Clear? So the correct answer here, that is papillary carcinoma thyroid. Now see the question number 4. Question number 4. Similar questions were asked previously in exam. Read the question and tell me the answer. You are a junior resident in the surgical department, and during morning post-op rounds, what? You see the following findings shown in the image. In a patient who underwent total thyroidectomy for medullary carcinoma thyroid 3 days before. Probable cause for this condition. Can you see? The patient is having carpopedal spasm. Carpopedal spasm. What is the name of this sign? This is Troisius sign. Carpopedal spasm, that is Troisius sign. And what's the cause? It is because of hypocalcemia. Now can you tell me what is the correct answer here? Patient is manifesting hypocalcemia on which day? Third day. On third post-operative day. Tell me what is the cause. I'm waiting for your reply. Very good. Rahul, correct. Yes, all of you are correct. Yes. Antidepressant contents. Very good. Everybody is marking A. All of you are marking option A, and option A is correct. What? There is parathyroid insufficiency. Again one question for you people. Again one question for you people, that on which day of surgery this parathyroid insufficiency is most commonly seen. I am waiting for your reply. On which day after surgery? Okay, somebody is asking, Venkatesh Chelankudi, when your NEET essence will be released? NEET essence will be released next week, guys. The book is already in the press. Very good. Rajesh, yes. 2nd to 5th day. It is not 3rd to 5th day. It is 2nd to 5th day. This is the question which is asked frequently. So it is because of parathyroid insufficiency. Another question for you guys. What is the most common cause of parathyroid insufficiency during thyroidectomy? Tell me. I'm waiting for your reply. Most common cause of parathyroid insufficiency during surgery. During thyroidectomy. I'm waiting for your reply. Most common cause of parathyroid insufficiency during thyroidectomy. Infarction, very good. Pankhudi Mahendru, first person to reply. Infarction, very good. It is vascular infarction. And why vascular infarction? Because certain surgeons are going to ligate inferior thyroid artery away. If you are going to ligate inferior thyroid artery away from thyroid, inferior thyroid artery ligated away from thyroid, in that case what will happen? Because parathyroid artery, it's a branch of inferior thyroid artery, and parathyroid artery is an end artery. If you ligate it away, there will be vascular infarction. So what's the cause? Vascular infarction. All these are the questions. Correct answer here. The correct answer is A. Now question number 5. Again a frequently asked question, asked both in surgery as well as in radiology. I'm waiting for your reply. I'm waiting for your reply. A 45-year-old male presented with abdominal pain and hepatomegaly. Ultrasound image is given below. What is the most probable diagnosis? First you guys tell me what's the name of this sign. It is floating. So what's the name of this sign? It's floating. So tell me, it's floating. So what's the name of this sign? It's not drooping lily. Yes, rest of you are correct. It's water lily sign. It's floating membrane sign, undulating membrane sign, or also known as water lily. This is known as water lily sign, and classically it is seen on ultrasound in which particular condition? Hydatid cyst. So water lily sign, what is this water lily sign? Whenever there is ruptured scolex, if there is ruptured scolex, what happens? This is going to float. So this is known as water lily sign, undulating membrane or floating membrane. So this is hydrated cyst. Tell me the most common organism responsible for hydrated cyst. I am waiting for your reply. Which species? Which species is most commonly responsible? I am waiting for your reply. Yes guys, tell me. Tell me. Shoaib Khan, Visa Garam, Anusha, Rahul Sharma. Very good. Rahul, first person to reply. Echinococcus granulosus. Okay. There is another question for you guys. This was asked in NEET PG. There is one type of species of Echinococcus in which multiple organs are involved and there are multiple cysts in one organ. Okay. So what is the name of that species which leads to malignant hydatidosis? Malignant hydatidosis. Tell me. Multiple organs are involved. It looks like malignancy. Which species? Very good. Sangam, Manish, Monica, Anshu, Shukla, Dreamer, Mahtab Alam. Everybody is marking correct answer. See, your preparation is really going good. Yes, it's Echinococcus multilocularis. Very good guys. It's Echinococcus multilocularis. Clear? So here the correct answer is A. Now question number 6. See the image. Look at the image. What you can see in the cervical region, what some kind of discharge is coming from some place, especially in the lateral aspect of neck. Here you can see. Now read the question. Read it. A 4 years old girl, what's the age? 4 years old girl presented with left-sided anterior neck swelling of about a week duration. It's painful, had progressively increased in the size, and there is accompanied dysphagia. Dysphagia. Though fever was absent at presentation, but it was later noticed on the second day of admission. So this patient is having fever also. She is having dysphagia also. History of being treated for URTI. So there is history of upper respiratory tract infection. 1 week before. No hoarseness, difficulty with breathing or features suggesting of hypo or hyperthyroidism. Okay, it means malignancy part is ruled out. Short history is there. Most probably it's the infectious pathology. All of the following statements are correct about this condition, except tell me guys what's the correct answer here. You tell me first what is the diagnosis in this case. I'm waiting for your reply. What is the diagnosis? Everybody is marking the correct answer. First tell me what is the diagnosis. What is the diagnosis in this patient? Yes? Shweta, this is? No, it's not subacute thyroiditis. No, it's not thyroglossal cyst. Very good, G2, very good. Rajesh, first person to reply correctly. Yes? Somebody is asking that sir, this lecture is relevant for BA MS students. Actually, I don't know exactly the syllabus of BA MS, but I think the topics are same. So you might get some new information here, right? So it's acute suppurative thyroiditis. What's the diagnosis here? This is acute suppurative thyroiditis. Okay. What do you mean by suppurative? Suppurative means pus collection. So what is the problem here? There is pus collection in relation to thyroid. That's why these patients are having pain, there is tenderness and there is fever. What is the problem? It is predisposed by upper respiratory tract infection and the most common organism is Staph aureus. Why it is more common in children? Because they have persistent pyriform sinus and it is on the left side. Persistent pyriform sinus on the left side, so it communicates oral cavity to the thyroid gland. You know that thyroid gland is usually resistant to infection. Why? Rich vascular supply, fibrous capsule, and it is having high iodide content. So the patients who are having some anatomical disorders like pyriform sinus or immunocompromised patient, or if there is penetrating trauma, in those cases only you are going to find this condition. Now see the option. It is more common in children, correct. Most common cause is presence of pyriform sinus in children, correct. Most common organism, Staph aureus, correct. Most patients are managed not conservatively. There is pus collection, so what? IND plus antibiotics. We have to give incision and drainage plus antibiotics. So incision and drainage plus antibiotics are given. That's why what is the correct answer? Correct answer is D. So everybody is marking correct answer. Antidepressant content, why not branchial fistula? It has connection with esophagus. Very good. So whenever there will be branchial fistula, what will happen? If there is connection with esophagus, in that case, if patient is going to eat something, patient is going to drink something, what happens? There will be discharge. And in branchial fistula, generally it is in location to the lower third of sternocleidomastoid, and there is seropurulent discharge, and it presents just after birth, means during this kind of history is not there, it is not related to upper respiratory tract infection. Clear? So that's why this is what? This is acute suppurative thyroiditis. Second important point, that since here there is persistent pyriform sinus, so because of that sometimes the patient is having dysphagia, but in branchial fistula dysphagia component is not there. Okay. So everybody is correct related to this. Now question number 7. It's a tricky question. First you read the question, tell me the answer. A child presented with mild abdominal discomfort, what? Mild abdominal discomfort and intermittent abdominal pain. Radiograph is given below. What is the most likely diagnosis? So here what you can see, that this is the dome of diaphragm and there is herniation of something. And if you see that content which is herniated, this is located anteriorly or this is located posteriorly. This is located medially or this is located laterally. This is on the right side or this is on the left side. 2-3 questions. First, it is medial or lateral. So see the location. Here it is lateral. This is lateral. It is on right side or left side. So left side laterally. This is anterior or posterior. So defect is posterior. Means there is left posterior lateral defect. Where is the defect? Left posterior lateral defect, and there is herniation of content in the thorax. Tell me, in which diaphragmatic hernia, congenital diaphragmatic hernia, the defect is located on left posterior lateral side? Very good, Monica. Monica Devarkonda. Everybody is marking. Ishika Jhajaria, Shweta, Jitu Meena, Dr. Manish, Aditya Roy, Dreamer. Everybody is marking correct answer. Clear? So see the image. These kind of images are asked and it's very easy to crack the question. Whenever the defect is somewhere here and herniation is here. So if you can find the defect or some kind of herniation in this particular region, this is right anterior medial, and this hernia is known as Morgagni. This is known as Morgagni hernia, and this is left posterior lateral defect. So this is Bach-Dallek hernia. What is the name? This is Bach-Dallek hernia. Clear? So what is the correct answer here? A. Bach-Dallek hernia. Now see, in this image you can see, in the first one, in this frontal view, here you can see there is large air containing walled structure near left lower lobe. Air containing walled structure, and in the lateral view you can see what is the location? Location is posterior. So in the lateral view the location is posterior. Yes, yes, Shoaib Khan wants to say that congenital diaphragmatic hernia is more common on left side. Yes, most of the congenital diaphragmatic hernias are located on the left side, and you know which ventilation is contraindicated? Tell me guys, I'm waiting for your reply. Which ventilation is contraindicated? Tell me. I'm waiting. Vikram, Aniket Singh, Brijesh Singh. Bag and mask. Manish, bag and mask, bag and mask. Bumblebee is also there. She wants to say that bag and mask ventilation. So you know the correct answer. That's why here the correct answer is option number A. Now question number 8. Again a repeat question. Similar questions were asked in radiology as well as in surgery. Tell me what is the correct answer. A 60 years old male presented to OPD with what kind of dysphagia? You can see progressive dysphagia and weight loss. What is progressive dysphagia? Dysphagia initially to solids, followed by semi-solids, followed by liquids. Yes, barium swallow was done, whose image is given below. First you tell me what is the name of this appearance. What is the name of this appearance? Yes. What is the name of this appearance? Very good. Apple core, Dr. Bismay. Apple core appearance. Yes, everybody is marking correct answer. This is apple core. An apple core on barium swallow, it is seen in carcinoma esophagus. So the diagnosis here, it is carcinoma esophagus. Now tell me guys, what is the investigation of choice for diagnosis? For carcinoma esophagus, what is the investigation of choice for diagnosis? Tell me. I'm waiting for your reply. Shaurya Singh. Yes, the Shaurya Singh has shown his Shaurya. So you are correct, Shaurya Singh. Yes, it is endoscopy with biopsy. Investigation of choice for diagnosis, endoscopy with biopsy. Now another question for you people. What is the investigation of choice for staging? I'm waiting for your reply. What is the investigation of choice for staging? Tell me guys. Waiting for your reply. Speedy Singh wants to say that, sir, apple core appearance is specific. No, it's not specific. It depends on the investigation. Imagine if you are performing barium enema. On barium enema, if apple core appearance is there, it is seen in carcinoma colon. So if apple core appearance is seen on barium enema, this is seen in carcinoma colon. This is seen in carcinoma colon. But if it is seen on barium swallow, this is seen in carcinoma esophagus. I'm asking the question, investigation, very good, Avish Chaudhary, Bharti Chopra. Yes, all of you are correct. Investigation of choice for diagnosis of carcinoma esophagus, it is endoscopic ultrasound. Now another important point, sometimes when you insert the endoscope, lumen is compromised, obstructed. So if lumen is compromised, it is obstructed. So what is the problem? Your endoscope will not go beyond this point. And whenever there is advanced malignancy going out of the lumen, in these cases, means in advanced cases, CET is investigation of choice. If nothing is mentioned, what is the investigation of choice for staging? It is endoscopic ultrasound. And if advanced malignancy is there is luminal obstruction, in these cases it is CET. Okay. Now see here. So this is apple core appearance. What is this apple core? You can see this is the lumen of esophagus and this is the tumor. So this much part is not visualized because only this central portion is patent. So if only central portion is patent, here you can see the passage of contrast is like this only. So this is apple core appearance. We eat apple. So how we eat apple? We eat apple, we leave something on the top, something in the bottom and something in the center. So this is apple core appearance. Another important question, similar questions were asked in the past. See the image. 45 years old alcoholic male was brought to the emergency with upper GI bleed. Upper GI endoscopy was done and the image is given below. Choose the incorrect option. What is the incorrect option about this condition? Tell me guys. First you tell me what's the name of this condition. Dr. Dreamer, Amit Kumar, Basu Patil, Jitu Meena, Mitali, Sangam, Himanshu, Dr. Monica. Everybody is marking correct answer. All of you are correct. Tell me the diagnosis first. Guys, tell me the diagnosis first. Abhinav, Shoaib Khan. Very good. Mallory Weiss. Everybody is marking correct answer. It is Mallory Weiss syndrome. And you know what is the location of this Mallory Weiss syndrome? The most common site is cardia here, just below GE junction. And here you can notice that it is because of partial tear. In this there is partial tear and it is involving only mucosa and submucosa. Which artery is responsible for bleeding here? Which artery? It is the left gastric artery which is responsible for the bleeding. Good thing that in majority of cases, since partial tear is there, only little or minimal bleeding is there which stops spontaneously. Means only observation is sufficient. Only in 20% cases there is massive bleeding. So in 20% cases there is massive bleeding in 20% cases. Clear? And in that case we have to go for endoscopic intervention, endoscopic electrocoagulation. If it is not available or failed, then we go for angiography plus embolization. If it is not available or failed, then we perform the laparotomy and we perform open surgical ligation. Clear, guys? So what is the correct answer? Partial tear involving mucosa, submucosa, correct. Left gastric artery is the source of bleeding, correct. Cardia is the most common site, correct. Associated with minor bleeding. In majority of cases there is minor bleeding. So this is the correct answer. All of you, Pickle wants to say that, sir, please go fast. Okay, Pickle, we will go fast. For you guys the speed is fine, or we should increase the speed a little bit. Yes. So incorrect. Yes, Shoaib, answer not associated with massive bleeding, correct. So what? We have to choose incorrect option. So that's why D is incorrect option. It is associated with minor bleeding. Sushant also wants fast. Okay, so it is associated with minor bleeding, not the massive bleeding. Very good. So here you can notice that this is the site of bleeding. So this is the partial tear, that is Mallory-Weiss syndrome. One question for you guys. There is longitudinal tear in, that is not tear exactly, that's perforation. So longitudinal perforation in esophagus. Tell me the name. I'm going fast. Tell me. Longitudinal perforation in esophagus. This was longitudinal tear in stomach. Mallory-Weiss tear. Longitudinal perforation. Borha, Vivek, very good Vivek. Sushant, Swapna, Manish. All of you are marking correct answer. That is Borha syndrome. Okay. Question number 10. Again, similar questions were asked previously in exam. In a child during elective surgery, this abnormality was detected incidentally. Which of the following statement is incorrect? First you tell me, what is this? What is the diagnosis here? Tell me guys, all of you. Yes, Sheel Patel, Monica, everybody is correct. Everybody is marking Meckel's diverticulum. Tell me, Meckel's diverticulum is congenital or acquired? Congenital. It's true or false? True. It's single or multiple? Single. And it contains all the three layers located along anti-mesenteric border. You know that in Meckel's diverticulum there is presence of ectopic gastric mucosa. This ectopic gastric mucosa, it is going to secrete acid. Apart from gastric mucosa, there is pancreatic. After that, colonic mucosa. So most common ectopic mucosa is gastric, followed by pancreatic, followed by colonic. Because of this ectopic gastric mucosa, all of you know that there is ulceration, and because of ulceration there is bleeding. So what is the most, because there is bleeding, so what is the most common symptom? Bleeding. Tell me the investigation of choice for diagnosis. Anshu, Shukla, Sarika, Divya, Kumari. I am waiting for your reply. Sheel Patel, Ishika, Jajaria. Yes. What is the investigation of choice for diagnosis? Because ulcer there is bleeding, it is technetium 99. All of you are correct. It's technetium 99. Clear? Now let's check the answer. Option number A contains mucosa, submucosa, muscularis propria. Correct? Most common ectopic mucosa, it is gastric. This is gastric. Diagnosed by technetium per technate scan. Correct? Bleeding is the most common presentation. So all the options are correct except B, and we have to mark the incorrect option. So correct answer for this question, it is B. Kautilya Chaudhary, yes. Akash Kumar, very good. Abhinav, very good. Now question number 11. Let me tell you, This question of pneumoperitoneum, it is asked every year in each and every paper. I am telling you this question, two questions which are asked every year in each and every paper. One, perforation peritonitis, and second, tension pneumothorax. And let's predict another question related to acute pancreatitis. 3 scores. One is Q SOFA. This is a question. Q SOFA. Second is Bishop. Third is SIRS, systemic inflammatory response syndrome. All these are asked, one of these almost every year. So question number 11. 60 years old male, known case of coronary artery disease, taking NSAIDs, was brought to the emergency with pain abdomen, tenderness all over abdomen. Can you see? Hypotension, chest x-ray showing free gas under right dome of diaphragm. Can you make it, guys? Can you see? Free gas under right dome of diaphragm. What is the next step of management? So this patient is having perforation peritonitis. Yes, tell me, option number A or option number D? Whenever a patient of perforation peritonitis is coming to your emergency, first you have to resuscitate the patient. So we have to give IV fluids, and after resuscitating the patient, we have to take the patient for laparotomy. So what is the correct answer? IV fluids with exploratory laparotomy. Conservative management, no role of conservative management. Ultrasound abdomen, not required. Emergency laparotomy, it can be done only after resuscitation. So correct answer for this question, A. I am telling you this question will be asked. There are chances that this question will be asked in NEET PG 2023. Question number 12. Can you see what is the name of this condition? Just by looking at the image, tell me, guys. Answer. Question number 12. Question number 12. Yes, reformer gave the correct answer. Devesh. Yes. Somebody is marking gist. No, you're very close. I know that your brain thinks gave, but you are writing gist. Watermelon stomach, which is also known as gave. What is the full form of gave? This is gastric antral vascular ectasia. Gastric antral vascular ectasia, everything is hidden in gave. Most common site, tell me. It is gastric antral vascular ectasia. So most common site is antrum. And what is the pathology? The patient is having vascular ectasia. Why it is known as watermelon stomach? Because whenever we are performing endoscopy, you can see these are the parallel stripes. Dilated vessels appears like parallel stripes of vessels, and these parallel stripes of vessels are looking like rind of covering of watermelon. So this is watermelon stomach. It is more common in elderly females. Most common site is antrum. 25% patients have chronic liver disease. Chronic liver disease is seen in 25% patients. Clear? Okay, so let's see how many of you have marked the correct answer. Abhishek Singh marked the correct answer. Sarika, Ishika Jhajaria, Chandra Babu, unique videos. Very nice. Shoaib, yes. Antidepressant contents, yes, he is having lots of colorful things. Neelam Bhatia, everybody, majority of you are marking correct answer. It is more commonly in females, not the males. So what? This is incorrect. B, antrum is correct, associated with chronic liver disease and vascular ectasia. So correct answer for this question, that is option number A. Question number 13. Again a repeat question. Sometimes straightforward image based question is asked in radiology, and sometimes integrated question is asked in surgery and radiology. Read the question carefully. 40 years old female presented with dysphagia to both solids and liquids. Given image, what is the name of this appearance? What is the name of this appearance? Yes, guys. Everybody is marking correct answer. Elsa, Didi, Rahul, Monica, Devarkonda, Sheel Patel, Vivek Yadav, Vrinda, Mitali, yes, Shubhra, Abhinav, Sherin, Pankhudi, Dreamer. Everybody is marking the correct answer, that this is rat tail appearance or rat tail sign. And all of you know that rat tail appearance, it is seen in which condition? achalasia cardia. Rat tail appearance, bird beak sign, pencil tip appearance, all these are seen in achalasia cardia. Very good. AK-47 wants to tell us that investigation of choice for motility disorder is manometry. Very good. Very good. So, correct answer is A. Now, see this kind of appearance. So, here you can see this is bird beak appearance or rat tail appearance, also known as pencil tip appearance. This is pencil tip appearance. In certain books, it is written that rat tail appearance is seen in carcinoma esophagus. Actually speaking, that is rat tail filling defects. That is rat tail filling defects. Clear? So, it is rat tail filling defects which is seen in carcinoma esophagus. Now, guys, question number 14. Again, it's a repeat question. Sometimes it's an integrated question between surgery and radiology. Sometimes plain image is given and diagnosis is asked. Monica wants to ask that, sir, achalasia is age specific. Usually the cases presents between 3rd to 4th decade, means or 4th to 5th. So, around the age is 40 years. Yes. Question number 14. Tell me guys, what's the diagnosis? All of you are marking D. This is intussusception. First, look at the sign. What is this sign here? This investigation is barium enema. This is barium enema. And here you can see this loop of bowel is not visible. Why? Because one loop entered into another. So, since one loop entered into another, this is intussusception. And what's the name of this sign? Tell me guys, what's the name of this sign? Claw sign. Everybody is marking correct answer. It's the claw sign. It's the claw sign. Everybody is marking correct answer. That's the claw sign. Very good. So, it is claw sign. It is seen in intussusception. Intussusception. Now, see the question. Child was brought to the emergency with abdominal pain and multiple episodes of bilious vomiting. You tell me, what is the most common type of intussusception in children? It is ileocolic. Means ileum enters into colon, and that's why there is obstruction. Because of that, patient is having multiple episodes of bilious vomiting. Diagnosis based on the given image, intussusception. These are the image based questions which are asked frequently. What are the radiological signs? Yes, very good. Everybody wants to say ileocolic. So, here you can see that this is intussusception. There is claw sign on intussusception. Which investigation? Barium enema. There is another sign. Since one loop of bowel enters into another, the internal lining is visible. It is looking like what? Coiled spring. So, this internal lining, it looks like coiled spring sign. So, claw sign, coiled spring sign, both of these are seen in intussusception. Question number 15, another image based question. Tell me the answer guys. All of you are correct. Question number 15. See the history. 60 years old American presented to emergency. 60 years age, American. Means person from developed countries with lower GI bleed. How much is the bleeding? 200 to 300 ml. First question for all of you, that in which case there is massive GI bleeding, lower GI bleeding, most common cause of significant lower GI bleeding. Yes, all of you are going to mark the correct answer. Very good. Diverticulosis, Monica. Aditya Roy, diverticulitis. It is not diverticulitis. This means inflammation. This is culosis. So, this is colonic diverticulosis. Bleeding stopped after conservative management. Barium enema was done. Image is given below. What is the most probable diagnosis? So, here you can see that this is sawtooth appearance, and it is seen in colonic diverticulosis. This is seen in colonic diverticulosis. So, correct answer for this question, that is C. This is colonic diverticulosis. So, correct answer for this question is option number C. See how it looks like. So, most common site of colonic diverticula, you know, it is sigmoid. And colonic diverticula, what is the cause? It is more common in developed countries because there is decreased fiber intake, decreased roughage intake. Because of that, what happens? There is constipation and formation of diverticula. So here you can see this kind of appearance. This is sawtooth appearance. Clear? So it is seen in colonic diverticulosis. Question number 16. Similar question was asked in a latest exam. I'm looking for the correct answer from you people. Tell me the correct answer. Read the question. 60 years old diabetic male presents with halitosis and swelling in the lateral aspect of neck. There is a swelling which on pressure gives regurgitant sound. Barium swallow image is shown. What is the diagnosis? Tell me guys. Diagnosis, antidepressant content, very good. Everybody is marking correct answer. Very nice. Everybody is marking pharyngeal pouch. And if I'm asking what is the name of this diverticula, you tell me. What is the name of this diverticula? Again, Isha, very good. AK-47, very nice. Zenker's diverticulum. Zenker's diverticulum, very good. So it is Zenker's diverticulum. It is pharyngeal pouch. This is pharyngeal pouch. Correct answer is C. Tell me, this Zenker's diverticulum is a true diverticulum or false diverticulum? All of you know that it is a false diverticulum. Why? Because it contains only mucosa and submucosa. And here you notice that there is Killian's dehiscence between thyropharyngeus and cricopharyngeus. Cricopharyngeus and thyropharyngeus. This Killian's dehiscence is there. What is the problem? Why there is dysphagia in patients of Zenker's diverticulum? You can see this diverticulum is compressing the esophageal lumen. So it's a false diverticulum. It compressed the esophageal lumen. So this is Zenker's diverticulum. Tell me the name of this procedure in which we insert the endoscope and endoscopic stapler. This is the endoscopic stapler. One end or one part is inserted into diverticulum, one part in the esophagus, and you fire the stapler. After firing the stapler, you create communication between diverticulum and esophagus. What's the name? Dohel-Mann procedure. And what is the other name of Dohel-Mann procedure? This is also known as diverticuloesophagostomy. Other name is diverticuloesophagostomy. This is Dohel-Mann procedure. Okay, these are frequently asked question guys related to Zenker's diverticulum. And what is the treatment of choice for Zenker's diverticulum? Cricopharyngeal myotomy plus diverticulopexy. What is the treatment? It is cricopharyngeal myotomy plus diverticulopexy. Cricopharyngeal myotomy plus diverticulopexy, and that is the treatment of choice. Clear? Next question, question number 17. Again, similar question were asked in medicine, in radiology, in pathology and surgery. Again, it's an integrated question. Very good. Jitu, Divya, Meet Patel, Himanshu Sharma. Yes, very good Himanshu. Rahul, Chand P, Neelam Bhatia, Nihal, all of you are correct. A 45 years old, what? Male. 45 years old male presented with recurrent attacks of cholangitis. So the term is self-explanatory. There are recurrent attacks of cholangitis and it is already hidden. This term is there in the diagnosis. MRCP and ERCP image is given below. So here what you can notice, there is stricture dilatation. Multiple strictures are involving both intrahepatic bile duct and extrahepatic bile duct. Both are involved. Multiple strictures are there and it is more common in males. What is the diagnosis? B. Primary sclerosing cholangitis. Primary biliary cirrhosis, it is an autoimmune disorder. That's why it is more common in females. And you know, here only intrahepatic bile duct is involved. There is progressive destruction of intrahepatic bile duct. What about Caroli's disease? You tell me, what is Caroli's disease? I am waiting for your reply. Tell me guys. Lal Bahadur Singh, Divya Kumari, very good. They want to say Pianka, associated with ulcerative colitis, beaded appearance. All of you are correct. Very good. Prune tree appearance, Anshu Shukla, very good Anshu. Sonia Shehrawat, very good. Now you tell me what is Caroli's disease? I'm waiting for your reply. Type 5, Abhishek Pratap Singh. Very good. Abhishek Pratap Singh, I think you are from UP because your name is, having some solid thing. Pratap Singh. So these kind of names are there. By the way, Caroli's disease is type 5 choledochal cyst. What happens in oriental cholangiohepatitis? It is also known as hepatolithiasis. So multiple stones are there involving intrahepatic bile duct, CBD involving gallbladder also. So here correct answer is B. This question is for you guys. See the age, 60 years old, male, presented with painless progressive jaundice. First you tell me, this painless progressive jaundice is the characteristic feature of which malignancy? I am waiting for your reply. Painless progressive, central dot sign, very good. Basit Altaf Shah, he wants to say on CT there is central. Saurabh Kumar wants to send some love for Kyrgyzstan. I love Kyrgyzstan. I used to visit Kyrgyzstan every year, twice, at least twice. I love you guys. Tell me now come back. Tell me, painless progressive jaundice is the classical feature of cholangiocarcinoma or it's the classical feature of carcinoma pancreas? Tell me. No, not gallbladder carcinoma. Raja Siddiqui carcinoma pancreas. No. Dr. Manish, first person to reply correctly. Painless progressive jaundice, it is classically seen in cholangiocarcinoma. See, there is progressive jaundice in carcinoma pancreas. Initially it's painless, later it becomes painful. But in cholangiocarcinoma, it is classically painless. Okay? See, on the basis of MRCP finding most probable diagnosis, what you can see? P means pancreatic duct, B means bile duct, G means gallbladder. Gallbladder is distended, and can you see here, there is a stricture here because there is abrupt tapering of bile duct. So what is the problem here? Malignancy must be located at this part. Where is the malignancy? Distal part of bile duct. So what is the diagnosis? It is distal cholangiocarcinoma. Very good. It is periampullary carcinoma. In periampullary carcinoma, 4 malignancies are included. Ampullary carcinoma, head of pancreas, distal cholangio and duodenal. So what is the correct answer? Here, distal cholangiocarcinoma. This is distal cholangio. Why not hilar cholangio? Because in hilar cholangio, the malignancy is here. Hilar cholangio malignancy is here. So gallbladder is not palpable in hilar cholangio, but it is palpable in distal cholangio. So all of you are, most of you are correct, I should say. It is B. Now read the question number 19 and tell me the correct answer. 50 years old women presents to the emergency for vomiting and abdominal pain. She has history of Crohn's disease on infliximab. She is receiving infliximab, but she reports that this did not feel like a flare of her disease. On physical examination, tenderness to palpation, her abdomen without any peritoneal signs means no peritonitis. Abdominal radiograph shows valves of Kerckering. What is the diagnosis? First you tell me, these valves are of Kerckering. It is seen in which part of bowel? These are characteristic features of which part of bowel? Yes, valvuli conniventis, valve of Kerckering. Jejunum, very good. Divya Kumari, Mahendra, Manish, Dreamer, Bismay, Deepak, everybody wants to say that it is jejunum. And here you can see there is circumferential ring-like pattern. So the jejunum is visible. If jejunum is visible, the obstruction is somewhere in the ileum. And if obstruction is somewhere in the ileum, it is proximal obstruction or distal obstruction. Obviously, it is distal obstruction. So this is distal. What is the answer? Distal large bowel, distal small bowel obstruction. Now, what is the characteristic feature of jejunum? Here you can see there is circumferential ring-like pattern. These are known as valvuli conniventis, also known as valves of Kerckering, plica circularis. How the small bowel obstruction looks like? There are two views in which one is supine view and one is upright view. If you see the supine view, here you can notice that multiple dilated bowel loops placed centrally, narrow in caliber, and on upright view there is step ladder pattern, multiple air fluid levels in step ladder pattern. What about large bowel obstruction? Here you can see dilated bowel loops placed peripherally, which is wider in caliber, and there is horstrations, and again on upright view there is step ladder pattern. So this is how you can easily make the diagnosis of small bowel as well as large bowel obstruction, because in large bowel obstruction wider loop, wider in caliber, placed peripherally, and there is presence of horstrations. Question number 20. Tell me which gallstone is this? Sarika, Sushant, very good. Antidepressant contents. I love your accent, sir. Thank you. Antidepressant content. I don't like antidepressant because I don't need them, but I love you. Okay. So what is the composition of given stone? This is yellow in color, and all of you know that lipid imparts yellow color. Lipid imparts yellow color. So what is the name of this gallstone? All of you are correct. Monica Devarkonda, Amit Kumar, all of you are marking the correct answer. What is this? Cholesterol gallstone. This is cholesterol gallstone, and there was similar question in the NEET PG. This was asked for the first time. What is the composition of cholesterol gallstone? Some of you are marking correct answer. It is crystalline cholesterol monohydrate. It is CCM. CCM. Clear? Crystalline cholesterol monohydrate, that is the composition. This question was asked for the first time in NEET PG. इसके पहले क्वेश्चन कभी नहीं पूछा गया था. This was not asked before. You have to remember crystalline cholesterol monohydrate. Question number 21. This was asked many times, sometimes in radiology, sometimes in surgery, sometimes an image based integrated question was asked. In a 45 years old female, abdominal ultrasound, diffuse wall thickening with hyperechoic nodule at neck, and what kind of artifact? Comet tail artifacts were seen. Comet tail artifacts. Now here you can see this is looking like some other sign which we are giving some on the Valentine's Day. You are giving lots of gifts. So this is one of the gifts which you give to the girls. Yes, what is the name of this sign? Very good. Mahtab Alam. Somebody is sending the ring also. Jitu Meena is sending that diamond ring. Very good. In the Rahul is also sending that. It's diamond ring sign, comet tail artifacts or V-shaped artifacts. Here you can see. So this is diamond ring sign, also known as diamond ring sign, also known as comet tail artifacts, comet tail artifacts, also known as V-shaped artifacts, comet tail artifacts or V-shaped artifacts. Clear? So it is seen in which condition? Adenomyomatosis, because there are hyperplastic changes in muscularis with mucosal hyperproliferation. Adenomyomatosis, that is the correct answer. Again, similar question was asked many times in exams. Image based question, integrated question. See. A 50 years old male was brought to the emergency with left sided chest pain and dysphagia. So what is the presentation? Left sided chest pain. There is dysphagia. His ECG and echo was normal. ECG echo was not done. Why? Because patient was having left sided chest pain. Sometimes this condition mimics angina, only this feature, but it's totally different. There is no cardiovascular abnormality is not there. Barium swallow image is given below. What's the diagnosis? So all of you know what is this appearance. This is known as corkscrew or rosary bead esophagus or pseudo-diverticular appearance. So this is corkscrew, rosary bead appearance or pseudo-diverticular esophagus. So what is the correct answer? Diffuse esophageal spasm. Diffuse esophageal spasm. Joy, Abhishek Raj, Dev Kumar, Vivek Yadav, Jitu, Monica, antidepressant, Gurvinder Singh Hora, he is also correct. Shefali Satankar, Gauri, Altaf Shah, D.D. Daly, okay, Rohan Panchal, Dev Kumar, Ruthless is also there, some ruthless person is also there, Ayu is also there. So that is diffuse esophageal spasm. So this is the classical appearance. Every year this question is asked, sometimes in radio, sometimes in surgery. So this is corkscrew, rosary bead esophagus, also known as pseudodiverticular appearance. This is a latest question. A 45-year-old male patient with paralysis operated for rectal prolapse. This patient is having rectal prolapse, and if you see the image, what you can notice in the image, there are two threads. So around anus, what? A thread is applied and the surgeon is tightening these threads. Now see what is this procedure. Tell me, what is the correct answer? Yes, Elsa, Avinash Singh, Mohammad Nikhil, Kavya, Pranithi, Gupta, Monica, all, Manoj Prajapati, Dheeraj, Ganga, Himanshu, Oshin, everybody is marking correct answer. That is C, it is Thiersch wiring. How we perform Thiersch wiring? See, around the anus, here you can see, we are going to pass a silastic band or nylon tape, and after that we are going for tightening, or sometimes you are going to use a wire or the suture around anus, and after that what? You perform the tightening. If you perform the tightening of this anal canal, what happens? The rectum is not coming out. So what happens in rectal prolapse? Since the rectum is coming out, the patients who are not fit, in those cases we can go for anal wiring or Thiersch anal wiring. So this is Thiersch procedure, also known as Thiersch anal wiring. Question number 24. Again, this kind of question is asked in radio and surgery. Sometimes an integrated question is asked based on this particular topic. See, chronic alcoholic patient presented with repeated episodes of non-bilious vomiting after meals. What kind of vomiting? Non-bilious. On the basis of CET, what is the diagnosis? Here you can see there is a cyst. So you can visualize the cyst and you can easily find that this is the stomach. The wall of stomach is collapsed. Why? Because cyst is compressing the posterior wall and pushing it towards the anterior abdominal wall. That's why little space is there. So when patient is going to eat something, patient is going to drink something, immediately that comes out. So patient will be having non-bilious vomiting containing undigested food particles. So what is the diagnosis? It is pseudocyst. Pseudocyst. Shraddha Tiwari, Anisha Sethi, Aisha Sethi, DC, Amir Kumar Jaina, Chandrakant Heldar, Osha Jasin, Sadhana Pathak, Sheel, Manali Khatod, Dr. Ravi, Avinash Singh, all, Vandit Sarma, Ruthless is again there, Pashupati Yadav, all of you are marking correct answer. Correct answer for this question is B. Now question number 25. This is very, very important question. Sometimes this question is asked with image, sometimes it is asked without image. A 60-year-old female presented with dull aching pain in the central abdomen. Laboratory evaluation, amylase CEA was normal. Amylase is normal, CEA, it is also normal. Image of CT and tumor cut section after surgery is given below. What is the most probable diagnosis? Tell me guys, what's the diagnosis? All of you are marking correct answer. Very good. Brijapat Sen, Viprajit Sen, Ruthless, Dheeraj, Himanshu Kamini, Gohel, all of you, yes, Sarika, everybody is marking C as the correct answer. C. It is serous cyst adenoma. How you can see that? There are microcysts, small cysts are there. Microcysts are there. This is microcystic. And if you see the CT finding, on CT finding, what kind of calcification? There is central stellate scar or sunburst calcification. There is central stellate scar. There is central stellate scar, or there is sunburst calcification. There is sunburst calcification. So central stellate scar or sunburst calcification is seen. This is serous cyst adenoma. So what is the correct answer? Serous cyst adenoma. In serous cystadenoma, content is serous, amylase is normal, CEA is normal. What happens in mucinous cystadenoma? Content is mucinous, here CEA it is raised, amylase is normal. Amylase is normal. In IPMN, both CEA as well as amylase are raised. CEA as well as amylase are raised. So, this is serous cystadenoma. The mucinous cystadenoma, only CEA is raised, amylase is normal or it is decreased. So, let me tell you, cystic neoplasm of pancreas is also very, very important topic. So, this was all about the discussion for today. Again tomorrow we will meet at 5 p.m. Yes, you guys are fabulous, majority, okay, somebody, you guys are fabulous, majority of you were marking correct answer, so your preparation is going on. Yes, you, how can we get this PDF, sir? This will be shared in this chat box itself, just wait for some time. Okay, everybody, thank you very much, thank you guys, love you all, thank you very much, and I'm eagerly waiting for all of you. Tomorrow we will meet tomorrow at 5 p.m. again, and tomorrow we will be discussing the image based question related to urology, important questions related to urology, burns, head and neck, neurosurgery, arteriovenous disorder, lymphatics, trauma, suture. So, general surgery part, this is very important. Tomorrow we will be discussing that. Okay, so let's meet tomorrow at 5 p.m. Bye bye everyone.